occupation as a blood donors that has been banned in India, but the maximum case of HIV, they're not blood transfusions, they are sexual transmitted. So what do you mean by effectivity? Effectivity means chance of having the in real life or in practical situations. That is what is effectivity. So there is the efficient route of transmission. What is the most efficient route? It is better, please remember, blood transfusion. Which is the most effective route of transmission? Effective route is not blood transfusion. Do not do this small silly mistake. Effective route of transmission, आपने क्या बोलना है? Sexual transmission. Blood has 5 to 10% effectivity. Perinatal, it 5 to 10% effectivity. And needle stick injuries, these are roughly around 1% effectivity, which is the most efficient. It is blood, which is the most effective. It is sexual route of transmission. Coming over more to the transmission modalities. Please note that the chance of having infection or giving infection from male to female is higher or female to male is higher. What do you want? This will have a larger area of exposure during sexual intercourse. So because female has larger area of exposure during intercourse, and the HIV virus is concentrated in semen more than the vaginal secretions, this makes the capacity of a male to infect a female much higher compared to a female to infect a male. Talking about more infectious, or there is more chances compared to oral or compared to the vaginal intercourse. Oral intercourse, please note that salivary secretions has the least, salivary secretions have the least amount of HIV, and first is seminal secretions, second is vaginal. Anal intercourse has more chances because of the HIV load. It is because of more abrasions, or it could lead to more blood mixing. Menstruation, of course, because of the blood mixing, it leads to much higher chance of HIV transmission. Adolescent and post-menopausal, they have a very thin mucosal lining, and because the adolescent age group and the post-menopausal, they have thinner mucosal lining, this makes them more susceptible, more chances of HIV infection to spread to adolescents and post-menopausal. In cases of infection of the genital area, there would be definitely more T cells, which are, and there is more blood into it. And because there is more T cells, more blood over there, in case the female or the male, they already have a sexually transmitted disease, there is much higher chance of spreading or giving the infection. Please note that the HIV viral load, it is highest during the window period. And because it has the highest chance of spread during the window period, therefore, we say that the window period is related to highest chances. And because there is a window period, I think you all would be appreciating and understanding this point that HIV does show an iceberg phenomena. It does show an iceberg phenomena. That means there are clinical cases and there are inapparent cases. These inapparent cases include the subclinical stages or the first asymptomatic stages, or even the people who are in window period. And although we know that window period has the highest chance because of more viremia in the window period. Coming over to the next point regarding host factors, the age for HIV, it is predominantly 20 to 50 years. They are also associated with high-risk occupation. Which are the high-risk occupations? It is like single male migrants. They could be the female sex workers, male having sex with male. There could be long distance truck drivers. So these are some of the vulnerable group, or these are some of the people who might be spreading HIV in the community. Talking about the clinical spectrum of HIV, the WHO has classified HIV into 4 stages, stage 1, 2, 3, and 4. The characteristic feature in stage 1 is that the patient would be asymptomatic or maximum having generalized lymphadenopathy. The lymph node would be slightly more than 1 centimeter, persisting for 3 months or more. So that is like nothing very special in stage 1. Now, in certain